about menopause and embracing and understanding the journey, Dr. LeBlanc. And just before starting with Dr. LeBlanc, we have a quick little Menti poll that I thought might be fun for us to do before kicking off. So if you have a moment, just scan the code or it's in the chat, and one word describes how you feel when you hear the word menopause. Dr. LeBlanc, handing over to you.
Oh, hi. Morning, everybody. How are you? So I'm just going to share my screen. Thank you for having me. Let me share my screen. Here, great. I'm excited to see the results of that poll, by the way.
We'll share it shortly.
Great. So without further ado, it's my privilege to be invited to your Massy Pulse seminar. And looking forward to having engaging conversations here and beyond on menopause, the healthy transition towards and beyond menopause. So let's go. So just a little biology. When we speak of menopause, it used to be that it was just that you had no period. But what does this mean and how does this happen? So what I always like to tell people that no matter what you identify as now, once you have those chromosomes that you at conception, XX, you are a woman, biologically speaking. What does this mean? From the minute you're XX and your sex is defined as being female, our ovaries start to go through hormonal changes once they're formed. What does this mean? We have eggs, millions of eggs in the ovaries, and can you imagine it? Even as a fetus, your eggs are going through development and then they're paused in a phase of division until you come to puberty. Yeah? So I want you to understand that. So it's amazing what our bodies do, biologically speaking, from a hormonal standpoint as well, even from conception. So here's a little diagram to show you that it's complex, but yet not complex. This little part here is called our hypothalamus or pituitary gland and our hypothalamus. And this shows how our brain also impacts on control of our ovaries and our uterus. Yeah. So what does this mean? Through feedback mechanisms, the brain tells your ovaries secrete, don't secrete, what hormones to secrete, in this case, estrogen and progesterone. And then that affects ovulation, the lining of your uterus. And then if there's conception or not, then we have a period or not, because then we're pregnant. However, that being said, if we get to menopause, when we going into the transition, we have a decrease in estrogen, and that is when we have the change in our hormones, and we're going into perimenopause and then menopause and then postmenopause. So what is menopause to be exact? Defining menopause from a medical standpoint, it is when you have had no period for 365 days. I've had patients that go to 364 and then on the 365th it comes back. So then they're not in menopause. But it's a natural period of our reproductive life. And that's what I want you to gather and understand. This is a natural happening in our reproductive life. This is expected to happen. Our hormones will change. But that does not mean we cannot be happy through that change. It does not mean that you're condemned to some life sentence of I don't know, whatever symptom you get or symptoms you get. It is something that we want you to embrace, understand, and know how we can be proactive, number one, to go through this transition and know that there is hope and it does not have to be all doom and gloom. So menopause, medically speaking, is no period for 365. But that being said, we can almost look at this transition as a syndrome because it has steps and it has all hills and valleys. And that's what we want to talk about. So is it one big change or is it many steps? Many steps. We have perimenopause. We have menopause, which is when you've had no period for 365. And then after that, you're going to be in postmenopause. Postmenopause is for the rest of your life because it's now post that defining moment of no period for 365 days of your life. So here are stages again in our reproductive cycle. We're born and we're a child. Remember, I told you those eggs are all there and you're not fertile as yet because you haven't hit puberty. So we just have those eggs in a pause. Then we have our period, puberty, which is menarche, which can happen. It used to be 12 years, but now we're seeing young girls even at 9 years old. And that's a whole different conversation. Then we have our periods and that whole fertility session of our lives when we're fertile and we can make babies left, right, and center. Then we come to around 40, and that is when we tend to see maybe at that time that we may get irregular periods and maybe a change in the quantity, the quality, and the timing of our periods. We're still fertile because we're getting periods and we most likely are still ovulating. And then we go in, so that's a premenopausal area. And then we go into the 365 days of no period, and that's menopause. And then we go into postmenopause where you're not fertile, you've gone through it, and now it's the other side of that hill or valley as we want to determine it, but it's our other aspect of our reproductive lives. So there are three main hormones that we look at, and that's estrogen, FSH, which is follicular stimulating hormone, and LH, which is luteinizing hormone. So as we go through, we'll see with the reproductive age that I just described, we see an increase in estrogen, and the FSH and LH are climbing slowly. But then when we get to perimenopause, we see estrogen coming down and the LH and FSH going up. The LH and FSH are coming from our brain. And because there's a feedback loop, because the estrogen is going down, the brain is saying, wait, let me send out FSH and LH to the ovaries because we're not getting enough estrogen. Even though the brain is aware unconsciously of this change, it's still going to try and help you out and give you more estrogen. However, there's a programmed time for that transition. And that is why during menopause, we see an increase in LH, FSH, and the decrease in estrogen accordingly. So all about feedback. Again, a nice little picture for you to have. When we're not in menopause, premenopause, they say we look more sexy, but then we may have some irritability, some cramps. We may have PMS symptoms that we're not noticing. We should pay attention to those symptoms. Then we go into perimenopause where our periods are irregular. We have all the symptoms we're going to talk about just now. And then your last period after the 365 days of no period, and that's when we hit menopause. And we have other things that we look at, and then postmenopausal. Yeah, so that's for you to have in your mind a picture. So perimenopause. This is a big topic online, social media, in our groups with our sisters, with our brothers, with everybody. It should be with everybody. And this is when the hormonal changes begin. It's not the end of it, it's when they begin. And this is when you can have intermittent spotting, longer periods, shorter periods, more frequent periods. Sometimes you have 2 periods a month, 3 periods a month. You think it's not done. You want to know what's going on. You might feel a little more irritable. You might have mood changes. You might have a slight night sweat. And that means you might wake up in the night between 1 and 3 or 3 and 4 and just feel like, oh, it's hot in here, even though the AC is on. You might need a little more fan and you're not understanding, but it's not lasting for long periods of time. You may get bloating. You may just feel totally out of sorts. And that is when we're looking at perimenopause starting. Yeah. So this is just, for you to understand, when we go through these changes, it's like some women describe it as like 10,000 things coming at you at one time. Are you hot? You're not hot. You're cold. You're not cold. And the major thing that we used to talk about with menopause, and I think that's why people thought that that was the only symptom, was your hot flashes and your night sweats. But there's so much more to menopause and this transition. I like to tell women that menopause is like a hydra. A hydra, as you can see right there, is a Greek mythological creature, and it has many heads. And why am I saying that? Because sometimes when we're treating perimenopause and menopausal women, and when I say treating, it's not an illness, when we're dealing with them, I should say, and walking that journey with you, they may have one symptom today, and when you try to treat that one symptom, they go, oh God, doc, 2 more just come up. And that's what a hydra is. You cut off one head, and then 2 grow back. And they're like, well, this is never ending. It ain't done. When is this going to stop? And that is how you may feel. But I'm here to remind you, reassure you, and let you know that it doesn't have to be like this. So here are some of the issues that we can see. We can see hot flashes, headaches, thinning of hair, loss of memory. You can see problems with your thyroid. You can see problems with your thyroid, with your heart, palpitations. Just 1 second for me. Just give her the lung teas. Yeah.
Right.
Yes. Bloating, indigestion, constipation, vaginal dryness, frequent UTIs or urinary tract infections. I tell women sometimes, all of a sudden, you have a coochie. And how come you know you have a coochie? And gentlemen out there, yes, all of a sudden we feel like we have a vagina. We're not really supposed to know we have a vagina. And that might happen. Your sleep is disturbed, strange dreams, ringing in your ears, and itching over the body. Your skin is changing. You get dry skin on the back of the hands or just all over the body. You get osteopenia or osteoporosis, which is your bone health. You just seem like so many things happening, and this is explainable from both a Western standpoint and an Eastern energetic medicine standpoint, because this is about the changes that are expected in our body, both hormonally and in the energies of our meridians, which I'll explain in a minute. So from a Western standpoint, we know that there's a decrease in estrogen, and estrogen does so much for the body. And that is something we are aware of. So then we also understand that these are expected symptoms. However, we need to understand what mommy, what granny, what tanty went through, because that's our genetic profile as well. And not only that, understand where we are. Were you proactive? What was your lifestyle like? How were you living? Were you eating well, or were you abusing the body left, right, and center, burning the candlelight at both ends? What were you doing? And all of that will impact on what that expected decrease in estrogen does to you. Are you highly stressed now? Are you in fight or flight consistently? What substrate are we dealing with that expected decrease in estrogen? And that is the key to almost all of what we will feel during this transition from a traditional Chinese medicine standpoint. So why am I bringing that in? As most of you should know, I'm an integrative healthcare practitioner. So I bring the Eastern and Western branches of medicine together. And by that, I do your diagnostic model through traditional Chinese medicine. So we expect, according to traditional Chinese medicine, and now we have meridians in the body, so those are energetic pathways. Those pathways almost mirror most of our nervous system pathways in our body, but the Chinese have mapped it out, and they're called meridians. Each meridian has 4 elements that we look at: yin yang, blood, and qi. So what is expected with this transition? In some of our meridians, the kidney yin and yang deficiency, a blood deficiency in our kidney, heart, liver, and spleen meridian, and a liver qi stagnation. This might seem like mumbo jumbo, but this is because our kidney meridian is almost our overdraft of energy from birth. It's our inherited essence. So it tells about our genetic makeup. And that is very important, because if we restore our kidney energies, yin, yang, blood, and qi, then we're again preparing the substrate for the decline. Our liver meridian is important for hormones, for bones, for tendons, for muscles, and the important emotion of the liver is anger. I say that because a lot of women report being easily frustrated, like looking at their partners and going, why did I marry you again? Why am I with you again? And it's just an irritability. And it happens even from a young age, be it migraines, be it PMDD, be it extreme PMS symptoms. And we socially had been taught that this is something to expect and accept. And today is where we want to open your minds to understand that it's not about accepting only and saying it's going to be and we can't fix it. It's about how can we do steps, little things to change these so-called expectations from a physical, mental, and spiritual standpoint. So what can we do? The important thing is that, first of all, know your numbers. Get your annual checkups, because this is important for you to understand where you are health-wise. It's about screening when it's appropriate for breast, cervical, colorectal cancer when the time is right. What does this mean? Your breast cancer screening, based on your family history, starts from 35 to 40, but you do your self breast examinations before that. Understand your breast tissue. Do your annual mammograms when the time is right. Maybe you need a breast ultrasound along with those mammograms. Do your clinical breast examination. Colorectal cancer, again, based on family history, or we start around 50, 55 to do your FIT, your colonoscopy, and so forth. Why am I saying that? Because you need to know where you're at from a physical standpoint and a medical standpoint, because as I just showed you, all of that decrease in estrogen can impact on all systems in the body. It's not an isolated island. It's not or one off. It's everything is connected. Listen to your body, most importantly, and speak to your doctors and your partners and your sister. And most importantly, do not give up. It's not going to, you're not alone. This is something we all have to face, but we can face it well together and we can make it work together. So, what should we do? From an early age, this is where we want you to get to be proactive. Understand the definition of health is a balance of body, mind, and soul. So, what does that mean? From a very young age, we need to have a change in culture and behavior. We need to have balanced diets. We need to exercise. We can use herbs when the time is right. We can use supplements when the time is right. You have to look after your spiritual being through meditation, what qigong, tai chi, there's acupuncture, there's cupping, and there is hormone replacement therapy. And that there describes, and there's talk therapy as well for helping your mind. And that there describes, maybe not all, but encompasses a very holistic approach to how we deal with this transition and the symptoms. Can we test for menopause? A lot of women come in screaming, I have a hot flash, I'm dying, I'm in menopause, test my hormones, I need them tested. The thing with hormone testing is hormones, as I showed you, are a feedback loop. When we take your blood, is a snapshot in time. So we may or may not see that decline. And when we see that decline, what do we say to you? You're in perimenopause, you're in menopause. How does that help you? So what we advise is listen to your body, understand your symptoms. So when you go to the doctor, and there are other hormones we test besides your reproductive hormones, like your thyroid hormones. So we would then have a good picture of where you're at, what you're feeling, and therefore recommend the appropriate tests. And then what tests are you looking for? There are 4 tests that we look at: estrogen, LH, FSH, and progesterone. If we are indeed checking your reproductive hormones, and that we use that especially when we're doing HRT or hormone replacement therapy to ensure that we're doing the right replacement. Because sometimes even we'll test testosterone because we may need to help your testosterone, and that's when we come to the libido and the lack of interest in sex and stuff like that. But it's not only about the hormones, and that's what I want you to understand. Yes, we can test hormones, but it's about the whole picture, where you're at, and understanding what you're feeling and knowing where your biological markers are as well. And does it match your physiological markers? Because sometimes, and most times, 2 plus 2 is never 4. You may be feeling one way, but it's not explained in your blood test. And then you go, well, what's going on with me? And it's not that you're going crazy, it's that your body, energetically speaking, and hormonally speaking, is going through the changes, but they're not translating to a blood test. And that is what we want you to understand. So you're not going crazy. You have the feelings, and it's about us getting you through that through diet, exercise, use of herbs, use of other techniques so that you feel a lot better. And this means that we have to be proactive for the younger audience out there and for the partners out there, because it's not something that's going to be totally free. And we want you to understand and plan for it and understand that you are investing in yourself, because that is self-care. That is the health of you in order for you to be wealthy, so to speak, and be functional and not just throw it all to naught and say, oh God, forget it. Well, I'm in menopause and that's the end of that. And there's no more life after that. We want to give you that hope. I want you to open your mind. I want you to recognize that there's a community out there. And I want you also not to fall into the traps of excessive supplementation, excessive this, excessive that. Don't go crazy. We can do it systematically, and you have support out there. So what herbs would I say we recommend? So, everybody, the doctors and everybody, the first thing they want to do is send you and give you a primrose, which is rose. Some of the herbs and formulas that I recommend include Romania 6 or Lue Di Huang, Romania 8, Bawe Di Huang, Bohiwan, Maca, which is an amazing aphrodisiac and hormonal balancing herb, Yin Yang Ho, which is horny goat weed, Damiana, cinnamon. Cinnamon is so powerful, especially when we start feeling a little kilkate and the palpitations and the anxiety. Vitex is so good for us, which is chastery berry, Dangwe, black cohosh, blue cohosh, wild yam. And I'll give you the story, wild yam. So when I tell people about their diet and they should eat yams, they go, yams. And then we have a yam in Trinidad called keep your man home yam. And when I first heard of it, because I would recommend people eating yams, and then my grocer said to me, "You want to keep your man home yam?" And I was like, "What the hell is that?" And then it hit me, the yams, because they produce progesterone. And now historically, the old people were saying, "Well, keep your man home yam." So they knew what they were saying, but we now made the connection. Wang Chi or astragalus, gardenia, white peony, and hawthorn. These are some, but not all the herbs that we can use for menopause. And this is where I would then make a formula or recommend. Most times I try to recommend that women use what's in their kitchen garden, in their spice rack, or even in Massy's spice rack, to see how we start before we have to bring out the big guns, which I call those supplements. Is it wrong to take supplements? Can we take too much? Can we take too little? Is it for life? When to take it? You know, some people end up taking 30,000 tablets a day and they get fed up. Ladies and gentlemen, this is a lifestyle we're talking about. This is for you to experience. This is your experience for life. This means it has to be something you can carry on. It has to be something you like. It can't be forced all the time. So what supplements are out there and what is good and what is not good? Very difficult for me to say, but these are common supplements that a lot of women and us as professionals may recommend. Omega 369, Omega XL. I tell people eat their fish, their chia seeds, their flax seeds for their omegas. There's vitamin D3, there's vitamin K2, vitamin B, magnesium glycinate. There's a plain multivitamin. All of those are worth it, but we have to know when we need it. When do I need the B complex? Do I need B complex? Do I need magnesium? When do I need these things? And this is where you need a guide to carry you along that journey. Don't just pick and match and choose one symptom and use that, because you're putting a plaster on a sore. And the thing is, we want to treat the root issue. We want to help you so that then your branches are flourishing. So you are having a healthy transition through this phase, expected transition through your reproductive life. So what's a good diet? This is where I'm reaching out to the younger women, even younger than those that are in perimenopause or menopause or postmenopause. And note, it doesn't matter which phase you're in. This is applicable to you in terms of what a good diet is. But if we are younger and we can be proactive now, this takes you to a better position. And those that are going through the transition, this helps you as well to feel better. A balanced diet, as natural as possible. Don't fall for the fat diets of using cabbage water, this soup, that, because a lot of people say, "Oh God, I'm gaining weight. Oh God, the weight not stopping." And then when they see that, they want to either starve themselves, eat salad whole day, like if they're vegetarians and they must only eat grass and must be cold all the time, and they're struggling through as they're eating it and they're not happy. So you're done stressed out, you're done gaining the weight, and you're not happy with what you're putting into your body. So you're already impacting negatively on your already impacted system. So it's about you finding foods you like, eating as natural as possible, the least amount of processed foods. And here's a tip for you. It's called yin tonifying foods, because we note that it's about the yin of our body, the vital moisture of our body, the vital coolness of our body that is impacted and going deficient. And if we use yin tonifying foods, then the yin will then control the yang fires, hence less night sweats, less hot flashes, less irritability, less spasms all over the body all of a sudden, like one pain here today, one pain there tomorrow, less headaches. The yin tonifying foods are what are very, very important and recommended. So, what are examples of this? It includes châtaigne, cucumbers, watermelon, lamb, duck, or goat, ground provisions, sweet potatoes, green figs, and the yams that I told you about, beans, kidney beans, lentils, black beans, avoiding the white sugars and the processed sugars and using more whole wheat and brown flours. Those are part and parcel of what yin foods are. So cucumbers, for example, and walnuts and pistachios. Amazing. So you could have half a cucumber to a whole cucumber with slight salt, and people go, "But I'm hypertensive." Hypertension does not mean you can have no salt. It's low salt. So hypertension is where we can use, cucumbers with the salt. So you do half a cucumber with a whole cucumber or a whole cucumber. You slice it up, a little bit of salt. So you're making a little chow, and you have that every day. Do that. Tell me how you feel. Watermelon, a slice every other day. Using the lamb, the pork twice a day. Dal, ladies and gentlemen. Amazing, nourishing, detoxing, amazing for the body and for the yin tonification. So those are different foods that we can incorporate. And you hear what I'm saying? Eat. I'm saying to you, eat. Because if you don't eat, then your body believes, your brain is tricked into saying she's in starvation. And when your brain says that, then anything you eat, it stores as fat. So what happens? We get more and more selectively plump. And that's what we don't want. So apart from the type of exercises we need to do to offset that weight gain due to the hormonal imbalance, we also have to give substrate so that the body is fueled, your metabolism is not affected, and is rectified to allow for healthier transitions and no excessive weight gain. Sleep. I'm highlighting sleep because without sleep, your meridians, your energies, your nervous system cannot rest. And if your nervous system can't rest, then you can't get restored and and dare I say regenerated over the night to prepare you for the day that's coming. And this is what is important because with sleep, then we're not in fight or flight, an effective sleep. So then you then avoid the weight gain, avoid the fluctuations in your emotional health because your nervous system gets to rest. So they get to remap. Those neurons get to rest. They get to not be hyperstimulated and firing the wrong thing. The neurotransmitters are put in check. Very, very important. So this, and why can't you sleep with menopause? So it's a catch 22. The reason you can't sleep too well for some people is again because of that yin deficiency and because of the yang fire. So this is where if we do what we have to do, be proactive, then those energies and those meridians will balance and allow for the shen or the spirit to rest and therefore have effective sleep. And this is ensuring, and if you say, Doc, I'm not sleeping, make sure you understand what that means. Are you falling asleep? Are you not falling asleep? Are you waking up because you have to go pee and then can't fall asleep? Are you waking up at a specific time and then you have to stay up for about 2 hours and then fall asleep? Those are important factors to understand and analyze because they mean different things. And that is what I want you to pay attention to as well. Don't just say you can't sleep and don't accept that you can't sleep, so you shouldn't sleep. What is ideal for us is 6
Dr. LeBlanc, you muted yourself.
Dr. LeBlanc, you're muted.
Please tell me I only just muted myself.
Yes, only
Okay.
just.
I would be very upset. So you see, the minute I talk about sex, I get muted. So, anyways, so this is so bad. So, ladies and gents, sex is something that everybody talks about but doesn't talk about. The reality is we do not have to lose interest completely. We do not have to be the ones that just don't want sex and have a headache every night. There's a reason why we lose our libido. There's a reason, and it includes vaginal dryness. It includes painful sex because of the vaginal dryness. It includes just our desire. And again, that is due to the imbalance of our kidney yin and yang. And medically speaking, it's the low estrogen, testosterone, and progesterone. So how do we combat this? Again, being proactive, talking with our partners, because something as simple as more foreplay, because you're getting older and then they need to understand what that is. So if there are men in the audience today, listen to the women. And that's what I want men to understand and take away from this today. That is not that I'm telling you you're going to have sex night and day if the woman does this, but I'm saying there's a reason behind it, ladies. And we all appreciate sex, most of us, and therefore we don't have to go into sufferation for life. And we have to be proactive and look at our diets, look at the exercise, look at what we're doing, and you'd be amazed how your whole attitude can change. Because if you're less depressed, less anxious, if you're sleeping well, then those energies are there and your kidney yang is there, and it makes you feel vital. It makes you feel desired. Your sexiness is there. So that selective plumpness doesn't make you feel less sexy, and that is what is important to understand. So how do we help this? With the herbs, with the meditation, with the Tai Chi, the Qigong, and then there's acupuncture and cupping. And acupuncture is amazing because it brings about the balance to those meridians that I discussed. It tonifies and it also clears stagnation. Acupuncture is amazing for almost all of the hydra issues that we have discussed so far when it comes to menopause and perimenopause. Acupuncture balances you out, tonifies you, settles your brain, and there's nothing in the needles. Again, this is based on the use of the meridians and working with different protocols. And of course, this is understand. And what's important for you to understand, every woman who is going through this transition, you're going through the transition, but not every woman feels the same. And this is what it's important, that everybody has to know you're unique. You damn right that you're unique. But however, we can help each person because we will see the patterns. We will understand the protocols needed. So we know, do you need acupuncture? Do you need cupping? Do you need both? Do you need herbs? Do you need supplements? And do you need HRT? And that, but you have to be willing to talk. You have to know there's support. You have to understand that this exists for you out there. And, contrary to what you're seeing on social media and everywhere else, we do have doctors that listen. And yes, we, the female doctors out there, we definitely listen in much more because we're your sister. And you have help out there. And it should be, and I definitely want it to be, and encourage you to understand it needs to be holistic. These are just pictures, for example, of the cupping I do on patients along with the acupuncture. So when we do cupping and acupuncture, as I said, we're supporting all the meridians, but from a Western standpoint, supporting hormonal balance, supporting mental balance, supporting digestive balance, because all of a sudden people go, I used to be able to eat this, I can't eat it anymore. I used to be able to do this, I can't do it anymore. I feel like I'm pregnant in midday. I feel like I can't eat this. And this is, you would be amazed at what these techniques, along with everything else I've touched, can really bring about a positive change to this transition journey that you're walking. For the men out there, we the women are going to tell you it's not only just she hormonal, she's a bitch because she hormonal. It's not that. We want you to understand, both in the workplace or at home, support your female friends and family. Speak to them and understand them, because we try to understand the men with their andropause. That's when they buy the Porsche and the BMW and they get a new Skettle. That's fine. But we try to understand you and help you through your journey. And we want you to be empathetic towards us as well. Open the dialogue, understand. And it's not men's fault alone, it's society, because men weren't taught to be empathetic in that way. We're changing that dynamic and that paradigm. But men have to be encouraged to understand, because if they understand, oh, the fluctuation is coming, do they know when to bring the ice pack, the cucumber, the walnuts? Can they walk with us? Can they hear us? We're not telling you to hear everything about our coochies and our bleeding and our not bleeding. We're telling you, understand where we're at, because it affects greatly our emotions when we are heard. When we are heard and able to vent it. Now, ladies, this is where, by venting, by allowing that conversation to be a healthy conversation, we're allowing for the vital flow of your chi, your yin and yang, and your blood. And therein allows for balance of your meridians, and therefore another important tool to us having this transition go through as smoothly as possible. So what's the plan? Know your body, understand your periods, understand when you started your period, understand your family history about their periods and their menopause transition, understand if you had migraines, understand if you had a lot of painful periods, understand how your flow is going, what is your flow, what is your cycle like, write it down, understand that, so you can come to the doctor with that information. Be proactive for the younger and the not so younger women out there. Eating right, exercising, and the types of exercise go from aerobic exercise to our weightlifting resistance training. And we can talk more about that, especially when we have to interact some more. Lifestyle modification, that's what all this is about. What we eat, how we eat, the quality of food we eat, the exercising. We have to bring that into picture. Don't say, oh God, now she's telling me go to the gym. Oh God, now I have to lift weights like I'm no. Listen to your body and understand Pilates, yoga, weightlifting, feel, because not what you did in your 20s, you can do in your 30s, you could do in your 40s. You understand? So listen to your body and understand it, and be guided by a certified trainer. Be guided by your group that you're walking with. Understand your exercise. Do your annual checkups. Look for credible sources of information. Don't everybody out there looking for a quick dollar. So don't be fooled by everybody. And most importantly, don't be afraid or shy to seek help and talk to someone or someone's. Have a huddle, talk about it. But don't be negative. Don't say, oh God, well, it can happen, I can pass. No, don't be negative. And that is very, very important. Let's know that there's a plan, that there's a way, that this does not have to be all condemnation, that there is a journey, a transition, and we as women can do this happily and healthily. In conclusion, please be proactive. Get a partner to exercise. Enjoy what you're doing. If you don't, then don't do it. Find a doctor, your counselor, your group of friends that are positive and that fit you and allow you to be you. Do not give up. It's not going to be all daisies, ladies. But you don't have to have such deep, deep valleys that you can't come out of it. It's not all daisies, but it doesn't have to be all doom and gloom. And please don't think of menopause as the end of your life and that you have to suffer through it all. This is for you to wake up and shake up. This is to open your mind to possibilities. This is to empower you. The takeaway is you're not alone. There is support, and we have this together. And holistically, we can get there from a mental, a spiritual, a physical, a financial, and all the other pathways. We can get there, but we have to understand our bodies, listen to our bodies, and this is the ultimate self-care package. And that is what I want you to take away from this. Thank you so, so much. I hope I did it in time. I am not sure. Somebody.
Thank you, Dr. LeBlanc. Perfect. Oh gosh, this was fabulous. So much important information and so vital for us to have these conversations. I know we have a lot of questions and comments coming in, including Jenny Lynn, who is endorsing acupuncture and cupping, etc. I think it'd be nice to share that word cloud now of all these words that have been coming in from the mentee, and then we can take a couple of questions, and we want to really
yes
continue. So lots of words here that how everybody's feeling about this topic. It's so important to continue the conversation as well. And so we just want to let everyone here know that I know you all know about the My Pulse app. So we're going to be, Dr. LeBlanc is going to be in the app. Sorry about that. So yes, she's going to be in the app. If you're not, for the next 2 weeks, guiding us along this journey. There are lots of questions coming in. Please send us a list of herbs. Please send us all this information. And so it's all going to be in there. And so please, if you have not registered to go on to the app yet, please go ahead and register. This is the this is a QR code to get registered, and we will onboard you onto the app so that you could get started. The challenge with the 2-week challenge is going to start from next week, Monday, and we're giving a prize away this morning to the first person to register for the app who hasn't already registered. And then this is just a little bit about the challenge and how to get into the challenge. So clicking on the social tab, within the groups, you'll see the Pause for Menopause group, and it'll work just like it does but how we did it with the nutrition challenge and financial well-being challenge. And Dr. LeBlanc will be putting in information every day and challenging us to integrate it into our lifestyle. So first person to register to the group will also receive a prize today. So we'll let you know, Christian will let me know at the end of this session who those people are. So great. So we have a couple of questions coming in here, Dr. LeBlanc. The first question that came in was, what is the youngest that perimenopause can start?
Yeah, so that's an important question. So it used to be in about 35, between 30 to 35. Now, I'm not going to lie to you, post-COVID, along with the vaccines, we did see an impact on our reproductive cycles. So we have seen women as low as in the late 20s, but it's usually from about 30 to 35 that we could see those changes occurring. Yeah, for perimenopause. And perimenopause can last 8 to 10 years, but it depends on you, the woman, your family history, your substrate, and how you've been as living lifestyle wise.
Right. Thank you. And if anyone else has questions and haven't put it into the chat, you can raise your hands. Ingrid, are you on still? Ingrid Thomas.
Yes, I am.
I was wondering if you wanted to ask your question.
Right. I can read it. Right. I'm 57 and I'm in the perimenopausal stage. I thought I was in menopausal stage until September last year. And I have been experiencing heart palpitations for the last 2 years. When they first occurred, I saw the cardiologist to rule out arrhythmia, anything else, and these tests came back negative. The palpitations are not as profuse as in the early days, but they still can be very worrying because I believe your heart either on or off, right? Is there anything, exercises, I'm currently working out to lose weight and build muscle, anything like complementary medicine that can be done or used to deal with this? From my research, this is all hormone related, something to do with a node around your heart that if it doesn't receive the estrogen can trigger these palpitations.
Yeah. So Ingrid, when you say you thought you were in menopause, but it changed in September, what does that mean?
Right. I thought that I was clearing the full year with not having a period.
You got caught.
Right?
Okay, right.
Yeah,
Okay.
and then it dialed back to September.
Okay,
And I had a
gotcha.
period. Yeah.
So from a medical standpoint, Ingrid, our heart tissue and we have like two nodes that control our heart rate. And the SA node is the first one that starts. But as we get younger, meaning older, our different tissues can get more excitable. And so with that change in hormones, they can try to overtake and make a coup on your SA node and therefore try to give you palpitations. That's one. Number two, you can get much more easily excitable in certain situations, and that puts you in fight or flight mode, and that could give you palpitations. So all this goes to say that from a hormonal standpoint and an energetic standpoint, what we're looking at once we clear that there's no heart issue and there's no serious arrhythmia per se, then I recommend as simple as cinnamon tea. So having a stick of cinnamon in a cup of hot water twice a day. You can add chamomile. So the brand is Twinnings. I think Massy sells that. If not, you should. Or we can make teas for you because sometimes the teas that they sell in the groceries are not therapeutic. So when you use those teas in the grocery, you need 2 bags to 3 bags for it to be therapeutic. Things like lavender as well, Ingrid. And then acupuncture and cupping will definitely help you with palpitations, for sure.
Thank you.
But I would recommend, Ingrid, and I know you're in Barbados, I assume from your accent. So finding a traditional Chinese specialist, medicine specialist, a certified specialist there to do a workup on you to understand, because I can do it remotely, but then I can't do your pulse and tongue diagnosis. And that's what I need to complete it to be able to then decide on a treatment procedure for you and a strategy.
Thank you.
Vanessa? Thank you very much.
You're welcome.
Can you hear me clearly?
Yeah.
Okay, great. So you spoke about sleep, right? And I'm having some sleep challenges, been having them for months now, where I would go to sleep close to 9 o'clock, and then I would wake up after 12, unable to sleep until 3 or so. And then I have to get up to prepare for work for 6. You were saying that there's a cause for this. So I just wanted to find out what could be the reason for the lack thereof.
So Vanessa, that is the Bajans who are out and proud today. So that's nice. So that is a classic heart and liver time, according to Chinese medicine. So this is where, because of the imbalance in the meridians, you're not getting to sleep at that time. Yeah. So, and you probably feel a little hotter at that time and may or may not have a sweat. So what you can do, you do have to look at doing things like Tai Chi, Qigong, yoga. If you exercise, look at weightlifting helps a lot, and aerobic exercise. But in terms of a herbal aspect, again, I don't know if Barbados should have it. In Trinidad, they call it Tulsi. Worldwide, it's called Tulsi. It's called holy basil. So that's a possible herb. There's chamomile again. There's hops. there's passion flower, there's some herbs that we can do. So there are different herbal concoctions that we can do. So I guess in one of the challenges, I'll put out some of those recipes. The thing about it is that it's always important to see where you get those herbs from. So I will put like certified suppliers that I would recommend, because of course everybody can't reach me because y'all are all, I notice Massy is regional, and I welcome that. So you know, we unless Massy starts to distribute my teas, I'm just a plug in there, but no, I'm just kidding. So we can do I can give you options for teas, but if you're home today, tonight, use the Twinnings chamomile, use 3 tea bags and add some if you have lavender there, you can use lavender. Tulsi is awesome for sure, and those things, and deep breathing and preparing yourself for the evening. But definitely the yin foods as well: shatine, walnuts. Shatine is water chestnuts. Looking at the yin tonifying foods, and you'll see a big difference in your sleep patterns. Vanessa, there's so much more, but I'm rushing because I know
Thank
you all have
you.
questions.
And so that leads into Charlene's comment. She talked about magnesium glycinate helping her with her sleep as well. And
Yeah.
she does bring up a question that, well, a topic that I was going to ask you to just talk about just very briefly. And then Dr. Weller is on as well about surgically induced menopause.
Yes. So I forgot to mention that. So you can have, what we've spoken about so far is your natural menopause, but you have surgically induced menopause. So this is where you've had endometriosis, fibroids, any gynecological issue, and they've had to take out your uterus or do a hysterectomy. Now, a hysterectomy can be a total hysterectomy with an oophorectomy, meaning they took out your ovaries, or it can be a total hysterectomy where they left your ovaries, so they haven't done an oophorectomy, or they could take out one ovary, or it could be a subtotal where they've left your cervix and left your ovaries, or taken out your ovaries. What we're looking at, the ovary part. So once they take out your uterus, you can't menstruate. So you're in surgical menopause because there's no menstruation for 365 days. But if your ovaries are there, you're not hormonally in that transition as yet. Yeah? So you will have surgical menopause, but you're not in that transition fully, depending on your age and what your ovaries are doing. So we still have to look at our ovarian function, and you will know the change. So you can still feel ovulation. You can still feel like a period wanted to come, but you'll have none. So you have to pay attention to your body in that case.
Thank you, Dr. Weller.
Hi, morning, Doc. Wonderful presentation. I mean, just amazing. We need to clone you and send these videos all over the place. And as a man, it was great to be educated about some of the nuances of this stuff. And I particularly like how you linked everything with all the domains of wellness, even the financial implications, the occupational, etc. And I had a question, because when you talk about the herbs and supplements, from my perspective, I've had the experience of using, for example, beetroot, which lowers my blood pressure. But then how much to use has been a problem. It's dropped my blood pressure so badly that I missed Juve 1 year because I couldn't get out of bed. Turmeric, which I use for inflammation, also affects sugar. And if you're pre-diabetic, and you're taking other medications. So I really like that you gave an overview of all of these complementary treatments, but how can we be careful about ensuring that they don't set us off balance when we're on other medications, etc.?
So that's a very important topic, because this is where people think that herbs and spices don't kill you. But you have to understand that pharmacological medicine started from plant medicine. And this is where, Dr. Weller, this is where you use certified herbalists, medical herbalists. This is where doctors like me who do integrative practice can tell you whether there'll be an interaction with herb-drug interaction. This is where we know the dose. So you remember I just said to you that the tea that you sell, you buy chamomile tea, it's never going to be therapeutic because they can't afford a lawsuit. So it's the same thing with the beetroot. They didn't tell you how much beetroot to take. So as a guide, because I can't see all of you, as a guide, for most herbs, we don't take more than 3 to 6 grams a day of that herb. And you don't take it for longer than 6 weeks. You take a break for 2 weeks, because the herbs and the food are supposed to support the body and heal it, so to speak. So it's always recommended, for example, Dr. Weller, when you start, I tell people start on the lower end of the scale to feel what that does to them. So a funny story, the ancient Amerindians and Indians believe, that the ones that cross the Bering Straits, they believe that what you need is what grows around you. So there I was in my yard, and I saw wild Corylea on my fence. And I thought, hey, maybe I need it. What does Wild Corelli do? Lowers your sugar, your pressure, and cleans your skin. I thought maybe I have skin problems. I just took what everybody would do, a handful, because that's what the old people say to do. And Dr. Well, I kid you not, I was talking to patients and falling asleep on myself. And when I looked, my pressure was like 80 over something. And that's when so you have to understand the dosing for sure. So you must always go on the lower dose and see how you're feeling. And if you can get in touch with a certified herbalist, then you understand what dose you need to start with. And we see the interaction. So if you're on turmeric, you can't use aspirin, warfarin, and all these blood thinners at the same dose because it's very potent. And we have to understand that. And also the form of the herb that you're using, be it a capsule, a tablet, a powder, a tincture, raw, and extract the root, all of that is important.
But I think that's so good. And I think the other point you made, which I want to reinforce, is using reputable resources. So even if you can't find the herbalist specialist, we also have all the resources online. And we kind of tend to go to the light, easy stuff like TikTok. But we also need to know that AI provides a lot of opportunities to ask questions, but AI is not gospel either. And I think to me, it's an opportunity to do some research and then take what you have found to your specialist, to your herbalist, to your doctor, and say, this is what I've heard. Tell me what's right, what's wrong. And we don't just jump into all of these rabbit holes and fads, which can be really problematic, especially when you're concerned and you want to be proactive. So I think that was a really important point that you made.
Thank
And
you.
I forgot for Vanessa and Ingrid, was it? The two Bajans. How could I forget soursop leaf tea? The dried soursop leaf tea for sleep.
Yes.
Fabulous. So I'm getting up. So we have two winners for our prizes. We have Sadiqa Mohammed and Christina. So that's fabulous. And I'm getting questions as to people just trying to navigate to join the group. So I just want to walk us through that quickly. And because we only have a couple of minutes. And Rashida, Rashida, do you want to just ask your question quickly before we do that?
Yes, I can. So, Dr. LeBlanc, I had a total abdominal hysterectomy about 6 years ago. And about 2 years ago, I just stayed just like that and I blacked out. I did angiogram, echocardiogram, thyroid test, adrenaline gland test, blood test, ultrasound, Holter test. Everything is coming back. It came back well. So could you have gone into the medical menopause 6 years ago and still having these symptoms? Could it be menopause that is causing this? Because everybody's telling me stress and anxiety, but I can't relate to stress because I don't feel stress. Then they're saying that things are in the back of your mind. I've done counseling. I've resorted to a psychiatrist because I think I need somebody to dig into my brain to tell me because I think I am going crazy.
I love that. I wish I could tape you. Did they leave your ovaries, Rashida?
No, it's a total abdominal.
They took everything.
Everything.
So this is where it comes from an energetic standpoint. So this is where it's almost like if your body just recognized that it didn't have estrogen. You understand? And so you got that change, but you might not have been proactive enough for that change that happened. So it's now really hit rock bottom. And so now that they've done everything physiologically, it's not that you're going crazy. Just try simple things like what we discussed here, eating differently, exercising. You don't need anybody to dig into your brain, but what you need to do is analyze, because a lot of us as women, we have been trained by society not to pay attention to our needs, especially from a mental standpoint. And it's so important for you to see you may be suppressing anger, especially, and worry. And if you're doing that, that impacts on your overall energetics. And so while it may seem I'm talking wahoo and you go, is she really a doctor? I am. I swear, studied very hard for it. But it's about you understanding where your energies are at and using different foods and something as simple, Rashida, as cupping in your state, and using qigong. So qigong is spelled QI, then space GONG. And I'll put that in your challenge. I'll give you a site that you can pick up some qigong practices and, being holistic, Rashida. So it's not that you're going crazy. It's that you are now going through the definitive phase of that drop. And more than likely that's because you didn't have that substrate. So you were running on empty. So your overdraft is out. So the bank has come to take everything.
But tell me, would that result in blackouts? Because I blacked out
Yes.
driving. And it doesn't
Yes,
scare the living daylights out of
daylights
me.
out to you. So if they have ruled out everything, what is happening is your circulation has been affected, because if any of you remember when you're pregnant, that you remember that you started getting varicose veins, that all of a sudden you saw veins all over, and then they said, well, why can't you hold your pee? Why are you holding your pee? And it's all because the effect of your hormone levels on your vasculature, on your blood vessels. Yeah. So sometimes it affects the flow of the blood, even going up to the brain, hence the blackout. So Rashida, once they have completely worked you up, for sure, and they've ruled out everything, including a Doppler of your carotids to make sure there's no blockage there, that everything is going good, try the yin tonifying, look at your foods, look at your body, and see if you're seeing a cycle of events. See if you're seeing a difference in certain symptoms during a month. Analyze and listen to your body, and then we could take it from there.
Okay, because I need something to stop this. I really need, I
In the
cannot handle it.
meantime, you could try, you won't get a chance to do it, but when you get a blackout, they won't get a chance to catch you with your blood pressure, but maybe have
When
some.
I did catch myself, because the first time it happened in the office, and when I tested my blood pressure, it was 202 over 101. The second
Yeah.
time it happened is a year and 9 months after, when I was driving home, and my blood pressure was like 168 over 91 or something like that. My
So
blood sugar, I walk with a blood pressure tester and a diabetic tester in a medic bag, actually. That's how paranoid I am.
mhm. And so what I think is there's what we call a vasovagal, and you have a hormonal dysregulation, so affecting your control of your blood pressure and maybe your blood sugar. So maybe they need to do a full 24 to 48 blood pressure monitor as well to see why you're spiking. Yeah. But try the yin tonifying foods, try the qigong, and see how your body's feeling. But if you're seeing that, and because that pressure may not be why you're blocking out, it could be that your pressure went low and your body said, oh shit, sorry, oh Lord, it went low, we need to bring it up, and it went over the top. You understand? So we
Because
need
I
to
am
really
on
see
blood
I
how
want
you're
pressure
to
doing.
make
tablets.
sure,
I am
sorry.
on blood pressure pills, diabetes pills, and cholesterol. So they tell me don't come off those pills at all.
Yeah.
Although my
Use somebody.
HbA1c is 4.7 now.
Yeah. Well, maybe we could talk later, because
Yeah, we can
Yeah.
connect you all. And then I think what would be great, just to make sure we all know where to keep connected with Dr. LeBlanc after this session that's coming to an end. For those of you who are on the app, who are not on the app, if you could register for the app using the link I sent earlier, but I will also, we'll send you an email today with another link so that, you know, you can be reminded of how to register, but you go onto the app. This is what the screen will look like on your desktop. Of course, on your phone, it's slightly different. You click on social groups, and then you can browse for the group in here. I have it added to my groups already. So pause for menopause, and you see we just had 11 people join. So you click here, you join the group. You can invite other friends from your colleagues to join the group. And from Monday, we will start with Dr. LeBlanc. And you can ask questions within the chat twice a week. She's going to be answering questions, etc., but putting in tips every day for the next week. So we really want to stay connected on this topic. Of course, within the app, you can also find under health, there are journeys which are related to menopause as well under the, let's see, women's health. Live well with menopause. And so that'll take you through information as well. As Dr. Weller says, you know, and Dr. LeBlanc, the sources of our information going on the internet wildly can also cause a lot of anxiety. I know that happens to me. So they're really going to guide us as to the sources. Dr. Weller, you want to say something quickly before we end?
One just last quick comment congratulating Dr. LeBlanc, and also reminding everybody that we have all those other resources. You may have an EAP program in your company that you can seek that counseling for when you need to support the balance. We have a wellness champions who will help you access some of this information. And I particularly want to say I'm so glad to see so many Massy men who have joined the chat. And we haven't heard much from them, but I'm sure they're learning a lot, because I certainly did. Look forward to more interactions and encourage everybody to get into the MyPulse app, join the challenges, and live well. practice, not just work-life balance, but whole life balance. It's so important. Thanks again.
See the Massy man getting picked up on the chat, so that's great. Thank you for supporting. You all are great ambassadors to the other men in our communities, so thank you. And Dr. LeBlanc, thank you as usual. We're already getting requests for you to come back, so we look forward to the next 2 weeks.
Thank you so much for having me. It's been a pleasure. It's really a good topic. It's a complex topic, and it's never ending, but we'll get through it.
Thank you. Have a great day, everyone.
Bye.
Bye.
Wonderful.